let's start with just tell me your first and last name just for the record.
My name is Robyn Kelley.
Okay, and Robyn, you have a son named Prince Kelley that's in the Cummins unit right now, correct?
Right, that is correct.
Okay, so Robyn, let's talk about some of the concerns that you have with your child being in there.
Lack of communication, lack of proper nutrition, lack of medication. They're being treated like castaway animals, actually. They're not getting the proper food. They're not getting proper medication. They're not able to send or receive mail at all. Emails are taking at least 2 days to be sent out, if they get sent out then. I haven't received a phone call, even though I put money on his phone account for him to be able to call me. I don't know if or when he will call. I don't know what's going on down there, but I've been told that they're not being fed enough to feed a 5-year-old. So, it's very concerning for me. Very concerning.
Your son's been at the Cummins unit for more than 10 years now. Is this the first time that you've truly been concerned about his well-being?
He's not been at that unit until he went to that unit in February of last year.
Okay. But he was at a prior unit and all that. So him just being in the system, of course you've always had concerns about your kid being in the system, but would you say this is the first time that you felt the need to contact Channel 7 to discuss your worries?
Absolutely, because I've never really felt like he was in danger, but now I feel like he is in serious danger. He's not able to keep a distance from anyone. There's just an impossibility on that respect. Everyone around him has tested positive. He's trying to keep his distance, but it's impossible. There's no way. The beds are 2 feet apart, maybe 3 at the most. So there's no way that they can distance themselves, and there's no sanitary conditions. I've been told from the inside that they are unable to maintain cleanliness, sanitary conditions of the sinks, the toilets, the showers. There's no sanitary conditions. They don't have masks. They don't have gloves. They don't have anything to maintain sanitary conditions in order to try to even avoid being contaminated with this virus. And so it's like he didn't receive a death sentence. Yes, he did something very, very bad. Yes, he has been in there over 70% of his time. He did deserve to get denied his parole last year when he came up. Yes, he did, because he had done things that he should not have done. However, he did not get a death sentence. He's up for parole again on May the 7th, and I think that he may very well get it granted, but he's not the only one in there, and I'm not concerned with just him. I'm concerned about all of them. Yes, I am very concerned about him. That is my only child. I wasn't supposed to have any children at all, and that is my only child. So yes, I am very, very concerned for his health. He has severe allergies. He's had them since he was a child. He's had to take medication since childhood for his allergies. They have not given him any medication for allergies since he has been incarcerated, period, at all, not once. He also has hypertension now that he's been in there for so long. And so that's another concern as far as health is concerned. But also the fact that they're not giving the proper medical treatment. They're not giving the proper nutritional treatment. They're not having sanitary conditions. They're not able to file grievances. They won't accept them. They won't give them the forms. And when they do accept them, they will not consider them. They won't work on them, basically. They're just not going to do anything. So they're not doing their jobs. And yes, I understand their fear, but there are people who have tested positive who have actually overcome the virus and are now negative, which means that they have developed antibodies that are resistant to the virus. So that means that they can come into contact with people who are actually infected and not get it again. That's just the way that works, medically speaking. And I'm not a doctor. That's not doctor's advice for anybody to go around anybody, but ask somebody about it.
Has your son been tested for COVID-19?
I don't think he has, because he does not have any idea if he is or not. My understanding is that none of them know in his barracks. None of them know if they have it or not. I think they may have tested, but they will not give them the results.
So you're telling me that individuals, they don't know if they've tested positive or negative for COVID-19?
Correct. He does not have symptoms, but he does not have any idea if he's positive or negative.
And have they actually physically tested him?
I think they may have, but they won't give them the results.
Okay, so you know for sure at least other inmates in his barracks have been tested. They don't have the results. You're uncertain whether your son was actually tested or not.
I think that he was.
Okay, but he doesn't know the results.
Right, and he doesn't know if he is or not. He's not showing symptoms, but he doesn't know if he's positive or negative. So
that's, with it being such confined spaces, we knew that this was going to infiltrate into the prison system. I mean, guards go home, they go to the gas station, they go to the grocery store, they have to live outside of the prison walls, they come back in, there's that potential for spreading it.
Right.
With all this being said, when was the last time you spoke with your son?
I saw him last in March. It was the day after my birthday, so it was March the 14th was the last time that I saw him. After that, they shut down visitation completely, and I have not seen, heard, or talked to him since that day.
Do you know why he hasn't been able to call you, or who has he been able to talk to relay some of this information?
He has been emailing a friend through the, and I'm going to say this, I don't care who doesn't like it, the extortionate system that they have set up for families and loved ones to be able to contact inmates via email, via sending pictures, and telephone service. It is extortionate, the amount that they charge to do this. I'm serious.
So they mentioned that they actually brought the rates down. What did that mean? What kind of discount did they offer you?
It didn't do any good. I mean, so they dropped the rates a few pennies. That still doesn't do anything for poor people, which 99.9% of population that are in prison are poor people. Their families are poor people. I have no income, so I'm poor people, I'm barely making it, I have health conditions that I may not look like it, but I do, and I'm concerned. But I'm very concerned about the inmates and all of them, not just my son, but especially my son, but I'm still concerned about all of them because all of them are affected by this. And I've seen a friend of mine, her brother in New York, or her half-brother in New York, he died from this virus. And it kind of broke my heart because, I've been communicating with this lady for quite a while. And it was like, anybody could have that happen to them. Sorry.
Oh, no, you're fine. And so, obviously, your hope is that your son is granted parole come May 7th. If he's not granted parole from that day, what's going to run through your mind?
If he's not granted parole, I'm going to be filing a lawsuit. That's just a matter of fact. I will be filing a class action lawsuit at that. I probably may do that anyway. I've got time to do that. I have the knowledge to do that and the ability to do that. So I will most likely, most definitely be filing a class action lawsuit against the state of Arkansas, the ADC, and a lot of other people. I could give you a whole list. The parole board, that would be included in there too, because they had no reason this time to deny him. But they're probably looking at class action law. There's already a class action lawsuit that's been filed against them for not providing sanitary conditions, for not, doing what they should. That's Frazier versus the Department of Corrections or something like that. I can send you the link or send you the complaint.
I think that the ACLU was part of that. Sorry, I had a little ant crawling. So at the end of the day, I mean, obviously we understand that this could have happened, but if it was left up to you, what would you change in the system right now with it related to COVID-19?
I'm sorry, I can just barely hear you.
Can you hear me now? Can you hear me now?
It's
Hello?
kind of difficult. Yes, I can hear you, but just barely.
Oh, sorry. What I was asking is, if it was left up to you, what would you change about what they're doing right now with COVID-19?
What would I change?
Mm-hmm.
I would change their medical approach, first and foremost, because their medical approach has been disgusting, to say the least. I mean, it's just non-existent practically. It's just, I don't know. I don't even know how to say it. It's just so disgusting. They are not providing sanitary conditions. They're not fitting in them. See, when people don't eat properly, their health deteriorates, and they're not being fed properly. Why?
Is it because of coronavirus that they're not being fed properly? As in, do you think that they're limiting the amount of kitchen staff, which then translates into they're not all getting fed the proper amount?
I don't know, but I do know that a lot of the food that is being distributed to prisons is coming from Cummins. Cummins is packaging up the food to be sent to other prisons. So other prisons are probably not being fed because they cannot sanitize the boxes or whatever they have coming in. But why are the people at Cummins not being fed properly? It doesn't make sense to me,
And you are telling me that you have knowledge that they're not all wearing masks.
They're not what?
You're telling me that you know that they're not wearing masks in there. Is that because your son's told your friend that, or his friend?
Yes.
Or okay.
Yes. And they're not able to distance themselves either. There's just no way. When you're in a barracks with anywhere from 60 to 100 people, there's no way to distance yourself. There's just no way of avoiding contact, close contact. So.
And tell me, how scared is your son while he's in there right now with this virus? Do they know? Are they given any updates from news? Are they able to watch the news? Do they know what's going on?
He's not saying it, but I can feel him, and I know that he is petrified. He is literally petrified because he does not know what's going to happen. He does not know if he now has a death sentence instead of the 15 years that he got, 11 years ago? He doesn't know if he's got a death sentence now or not, because he said specifically that the ambulances are there daily, every day, picking up people from that unit. And if they're picking them up, they're taking them to Jefferson Regional Hospital, no doubt. And so that's another epicenter. And we know that a staff member at that facility did pass away because of the virus. And so, yes, I think all of the prisoners are scared to death. I think that they are in, serious trauma right now. They don't have any idea what's going on. They can't contact the outside except for very little communication if it gets to go out at all. There's no legal mail allowed in or out. You know, tampering with the federal mail is against federal law, and that is pretty serious crime there, you know, and that's what they're doing, basically. So I don't know what to tell you, but
Robyn, I got one more question. I have one more question for you. If your son is able to watch this, what would you want to say to him right now?
If what?
If your son is able to watch this, what would you like to say to your son right now?
I will say to my son, Prince, I love you, and I will do everything I can to make sure that you get out. And also, they will be paying for this. Oh, trust me, because this is working my nerves big time. And I'm going to be going to bat for every other prisoner that's in there, everywhere in Arkansas. Believe that. Yes, indeed. I wish I could hug him, but, you know, that's impossible right now, too. I don't care if he has the virus. If he is tested positive, I don't care. I go pick him up. I will bring him to my house. He could be under house arrest. I'm not concerned about getting the virus. If it kills me tomorrow, I wouldn't care as long as he was with me. Because I have no one else, period. None. I don't have anybody at all. You know, I have critters, but, you know, they might eat me. If I don't feed them, they might eat me. I really don't want that. But if he was under house arrest for being positive, that would be fine with me, just as long as they let him out. And he would not have to be in contact with anyone else except for me. I have an N95 mask. I have gloves.
You've got what you need.
I have what's needed because I had to buy it for a woodworking class.
Okay.
It was necessary, you know, particulates, you know, we had to have a mask that would filter out all particulates, you know. So I have the right kind of mask, and I have the other kind too, but I also have that particular kind.
So you're prepared in case he's able to come home?
I am prepared, yes.
Are you, what was I going to say? Are you going to be able to update me if and when he has that parole hearing? Because I'm sure it's going to be a teleconference on May 7th.
Absolutely.
I'd love to get an update from you on anything else. So
absolutely, yes, I will.
Robyn, thank you so much for speaking with me. I really appreciate it. And you have my cell phone, so feel free to text me and give me some updates.
Thank you so much.